Hey, what's the difference between objective data and subjective data, and how can we use it to our advantage as a caregiver when we report to our supervisor? Let's find out on JoJo the Caregiver Show. Okay, folks, today we're going to learn about the information that we should be collecting as caregivers to pass on to the healthcare team to get our client the most effective care possible. This information is part of our observation skills. Now, observation skills is basically an active process of gathering information to pass on to the healthcare team so they can provide better, effective care to our clients. This is a very important part of our role as a caregiver. We want our client to get the best care possible. So our observations and reporting skills have to be good in order for the healthcare team to make those important decisions about our clients. Now, observation information, or what they might call data, can be broken down into two different areas. We have objective data or information, and we have subjective data or information. Objective data means we're actually going to use our senses to gather information about our clients. So objective data are things we observe about our client using our senses. So we're going to use our sense of sight, our sense of hearing, our sense of smell, and our sense of touch. Now, the sense of sight is the big one, right? Because we can do assessments on our client. We can see their skin. When we're observing their skin, we're assessing for any changes in their skin. Are there bruises? Are there rashes? Are there new moles that we have to report to our supervisor? A lot of things that we can use our sight for. Is our client coughing? What is the client's movements like today? Are there any changes in their movements, like stiff, jerky movements? Tremors are starting to appear. We can use our sense of sight to observe their urine, their feces, how they look. We can use our sense of sight to see how our client is completing their activities of daily living. So how are they walking, their mobility, how are they actually doing their activities of daily living. We can use our sense of sight for many different things to assess our client. Sense of hearing we can also use as part of our objective data we're collecting. Sense of hearing, so we can hear our client breathing. How are they breathing? Are there any changes in their breathing patterns? Are they making any noises that we can specifically report to the healthcare team? Are they coughing? Are the client's responses normal, or is there a change in our client's response? So maybe you're going to get indicators that the client is not responding in the normal ways. Could be the start of different types of cognitive impairments. So we want to make sure we're using our sense of hearing accurately to gather information. And we can use our sense of smell. Sense of smell is good for detecting infections in our client. Sense of smell with urine, feces, different wounds your client might have. Usually an overpowering smell means an infection has occurred. Sometimes serious disease can also be determined with our sense of smell at first. We pass on that information, let the healthcare team do their further assessments. And the last one is sense of touch. So sense of touch, we can touch our client's skin. We can see if they react to us touching their skin. Maybe there's pain. We can touch their forehead, determine a fever. Those types of things we can use our sense of touch for. So those four senses all make up our objective data or objective information that we're going to pass on to the supervisor. The other type of information that we can gather is called subjective data. Subjective data are basically the things that our client tells us that's going on without using our observations. So in other words, subjective data is not observing, it's what the client tells us. One of the ones you have to pay particular attention to is pain. Whenever your client tells you they're in pain, any part of the body, That's subjective data. You should report that to the nurse right away so they can get the proper assessment and medication if they need it for their pain. Other areas of subjective data are maybe your client tells you they didn't sleep well last night, or your client tells you they have a headache, client tells you they feel dizzy. Anything that is a change in your client's behavior that they're telling you is considered subjective data. So again, objective data are things we observe. Subjective data are things that our client tells us. We're gathering all that data or information together. Then we're going to pass it on to the nurse either with a verbal report or through documentation. So the idea with verbal reports and documentation is to be as accurate and concise as possible. We never ever use assumptions. We never ever use interpretations. We never ever use what somebody else tells us. You're going to report your information that you observed and your subjective data that you heard from your client, okay? So be as clear and concise as possible when you're doing verbal reports or documenting reports. Hope that was helpful, folks, and I'll see you next time on JoJo the Caregiver Show.